Welcome back. In your morning medical news, tick-borne disease cases are on the rise in this country. The number of these illnesses reported each year has quadrupled over the past 2 decades, according to the CDC. Experts believe many more cases are not being reported. Mandy Gaither has more on why we could be seeing more tick-borne illnesses and how to protect yourself.
They're a growing threat. Tick-borne illnesses are on the rise in the U.S., and ticks are out now through early fall.
It does seem like it'll be sort of a hot year for ticks.
Experts believe the increase in tick-borne diseases is due to several factors, including climate change. The rising heat and humidity helps ticks thrive, growing tick populations, and improved disease tracking. While there are several illnesses that ticks can cause, Lyme disease is by far the most common. More than 89,000 cases of Lyme disease were reported to the CDC by state health departments and the District of Columbia in 2023. But the agency says many more aren't reported. If left untreated, Lyme disease can cause serious health problems.
Early symptoms of Lyme disease, unfortunately, going to look a lot like the flu. So there'll be things like fever, fatigue, headaches, and muscle aches.
There may also be a rash that looks like a bullseye. Experts say to protect against ticks by minimizing any exposed skin where they can bite. In areas where they're common, wear long sleeves and long pants, with the pants tucked into your socks, and wear a hat. Also, thoroughly check yourself and your family after spending time in high-risk areas like woods or tall grass.
Anyone else feeling itchy? Currently, there are no vaccines for any of the diseases that are carried by ticks, unfortunately. Experts say several vaccines are in clinical trials currently, though. And the CDC is contradicting the health secretary on COVID vaccine guidance for children. The CDC now says kids 6 months and older with no underlying health conditions may receive COVID-19 vaccines after consulting with their physician. The updated recommendation directly contradicts Health Secretary Robert F. Kennedy Jr., who said last week COVID vaccines are no longer recommended for healthy children or pregnant women.
Translation for shared decision making, that means talk to your doctor. Now, not everybody has a doctor, by the way. 1 in 3 people in this country do not have a doctor. So that's one challenge. In terms of the kids, we know that kids under the age of 2 are those highest risk after the elderly for ending up in the ER or the hospital. And okay, most of them are not going to die, but as a parent, I don't think you want your kid to end up in the ER or the hospital.
Vaccines for pregnant women still not recommended by the CDC and are now listed as no guidance, not applicable on the agency's website. And the American College of Obstetrics and Gynecology does still recommend the vaccine for pregnant women. Your morning coffee habit might be doing more than just waking you up. A new study looked at women in their 50s who drank 1 to 3 cups of caffeinated coffee daily. They were more likely to reach older age free from major chronic diseases and maintain good cognitive, physical, and mental health. Researchers acknowledge lifestyle and dietary factors, but the lead author says coffee itself might play a role. And some local medical news. June is Dementia Awareness Month. Staff at the La Crosse County Historical Society getting a lesson on what symptoms to look out for. That was led by dementia care specialists from the Aging and Disability Resource Center, part of an effort to educate and support people living with dementia and their caregivers. Right now, about 2,800 people in La Crosse County are living with the condition.
An enrichment opportunity that we're providing here tonight in advance of our busy tourist season is how to feel more comfortable working and supporting individuals who they may be interacting with on their guides and on their tours and in our museums.
We'll have a full list of dementia awareness events on our website.